Welcome, everyone. Okay, yeah, next slide, please. I'm Dr. Arturo Durazo. My pronouns are él, he, him. I'm the director of UC Merced's Nicotine and Cannabis Policy Center. I'm also an assistant professor of public health. Today, we're focusing on equitable enforcement of tobacco policy and with special attention to tobacco retail licensing, and also how we can carry this discussion with a special focus to the San Joaquin Valley, which is a big component of the Central Valley of California, our local Sierra Nevada foothills, and also rural realities, because we are aware that a lot of these issues stem, across the state, especially where there are counties with more rural settings. And our aim today is pretty practical. We want to first have clarity around what we mean by when we say equitable enforcement, of tobacco-related policies, and how there's alignment. And also to start a discussion around how the local perspective, like we're taking it away from how do scholars and academics who are at the university setting, we think about policy and implementation and enforcement, but also sharing that platform, from different perspectives, and which is why we have this really great panel prepared for you today. And also, we want to make sure that we leave our meeting today with some tangible steps. We want to think about how this can kick off a co-created, a collective policy and research agenda. So definitely our goal, and which is the spirit of us as the Nicotine Cannabis Policy Center, is keeping this people first and solution oriented. And let's move into the housekeeping. Okay, you are there. All right. We are going to have a Q&A, but we'll get through the speakers first. So we'll have each of the individuals present first. Also, please utilize the Q&A function for your questions. As people are speaking, if there are things that are very obvious or anything related to the NCPC, we will make sure to kind of answer as we go along, so we don't have to store all these questions as we go. And then once we get to the Q&A, we'll have that dedicated time. We will be recording this session, this webinar, and it will be available at the NCPC website. Also, we will be compiling an executive summary of today's webinar, if that is, that we will distribute later to people who joined. Next slide, please. So before we move forward, I'd like to take the time for each of our panelists to introduce themselves. It's just in the order that they will be presenting. So I first, each will please give us your name, your role, and I have a question for you. In one sentence, please do tell us how your work touches health-related policies. And I will now first start with you, Dr. Bayan.
Sure. Good morning, everyone. My name is Denise Bayan, and I am an associate professor at UC Irvine. And we'll mention I was previously an assistant professor at UC Merced, and I'm really grateful I still get to be an affiliate with the Nicotine and Cannabis Policy Center, now 2.0. And to my work is really health policy. I am a health policy researcher. I am not a lawyer, so really happy to hear from an attorney later today. But yeah, I do policy surveillance work. I spend a lot of time with bills and ordinances and thinking about policy processes and outcomes.
Thank you. Dr. Herrera.
Hi, good morning, everyone. Nice to be here with you all. My role, I'm a postdoctoral researcher at UC Irvine, and I have the pleasure of working with Dr. Denise Bayan. And my work really touches health-related policies by translating equity-driven research into actionable insights that shape tobacco control.
Thank you. Welcome. Jessica.
Hey everyone, I'm Jessica Breslin. I'm a senior attorney at Change Lab Solutions. And I would say all of my work touches policies. We work on law and policy related to public health at Change Lab. So that could be developing model policies, or we do a lot of informational fact sheets and trainings and things like that. And we define public health really broadly. So for example, I do a lot of work around public benefits as well.
Welcome. Thank you so much for being here. And also now I turn over to Layla.
Good morning, everyone. My name is Layla Galamrazai Eha, and I'm with the Fresno County Department of Public Health. I'm a health educator, and I oversee the Fresno County Tobacco Prevention Program for our county. And working at the local level, we work on health policies every day, whether it's in the implementation, the planning, and adoption stages. So we kind of work on all of the policy pieces.
Thank you so much for being here. Actually, a lot of, our thinking about doing this is inspired by what's been going on in Fresno. So I'm really excited to hearing from you and Jessica. Jessica, welcome.
Hi, thank you. Good morning, everyone. My name is Jessica Ventura, and I'm a health education specialist for the Tobacco Prevention Program at the Fresno County Department of Public Health, so also with Layla. And I think a lot of what she says overlaps with the work, but I do just want to add that we really focus on creating healthy environments by keeping it smoke and tobacco free. And that is in large part through education. So we like to raise awareness in the community, but also through local policies that benefit residents all across Fresno County.
Thank you so much. And welcome, Jessica. It's great to have you. So our agenda is, which we already went through the order. So since we already went through the order, why don't we go ahead and kick that off? And as I've already mentioned, we'll have a Q&A, and then we'll have some closing remarks. So why don't I turn it over now to Dr. Denise Payan.
All right, thank you so much, Dr. Durazo, and to the whole NCPC team for coordinating this event. And so I'm actually going to talk about flavored tobacco sales restrictions. This is an area where we've seen a lot of dynamic policy in recent years, particularly in California. And so I take a step back and provide a policy update of already enacted and implemented policies, so we're all kind of on the same page before the next presentation. And so this first slide just provides a little bit of context. I know we have quite a few students and folks who are stepping into new roles. Like I actually am a nutrition policy researcher who 8 years ago started to work in the tobacco and cannabis policy space. And so some people might be coming from different areas. And so this is kind of an agenda setting page where in public health, really a huge motivation for focusing on tobacco, this type of policy is to reduce tobacco use and access, because it is a leading modifiable risk factor for cancer-related deaths and also contributes to other environmental and health harms. And regulating flavored tobacco and e-cigarette products is really central for prevention because of some of the reasons you see here, particularly attractive for youth. And so because of federal policy, which I'll talk about briefly next, we still see these disparities. So disparate use of menthol cigarette use among Black and Latino young adults and adolescents, rural-urban disparities. And we know at this point that flavored tobacco sales restrictions can reduce access and use. And what I included here, but there's several other studies I could have included. This was something that a colleague led using CHIS data and compared before the state's policy was in effect, was looking at local comprehensive flavored tobacco sales restrictions with other jurisdictions in California that did not have this policy. And you see these reduced odds, 30% lower odds of using any of these products among residents with a policy in place. And then just we've seen widespread state and local policy adoption. As of earlier this year, we have 8 states. We've passed the 400 mark this year for local jurisdictions that have this type of policy, and 3 Native American tribes. Next page. I will put the caveat that these policies look really different. So that I'll talk about that in a minute. But here you see kind of the picture where you see the states that have enacted a statewide restriction, and then you see other areas in the less dark colors that have several jurisdictions that have adopted this type of policy. So this is an area of high interest, and a lot of places are looking to California to see what we do next in this space. So next slide. this is not an exhaustive or comprehensive review of these laws. I think I really am pulling out some key details to try to understand where we are and where we might be going. So a lot of you are very familiar with this 2009 Family Smoking Prevention Tobacco Control Act that restricted flavored tobacco product sales at the national or federal level. But there was these key exemptions like menthol as part of that policy. And in California, we have Senate Bill 793 that prohibits retailers from selling or possessing with intent to sell flavored tobacco products. Won't go through the referendum and those processes, but now as of December 2022, it's in effect. But it does have exemptions. So our state's policy here has exemptions that you'll see in the lower part of that table. So while it covers products, including e-cigarettes and these other types of products and flavor enhancers, there are 3 exemptions on the product side. So hookah and shisha, pipe tobacco, and premium cigars. And an important part of the Senate Bill 793 that a lot of us were really excited about, that even with these exemptions at the state level, local jurisdictions that don't have these exemptions and are more comprehensive are still in effect. So Santa Ana City, which is close to me here in Orange County, has a more comprehensive ordinance, and that's in effect in that space. But all other areas that don't have their own policy or had more exemptions have the state's bill. Next slide. But what has emerged are these policies. So aside from the product exemptions, we've seen some design gaps and challenges. So with SB 793, it was unclear whether the penalty amount included was a sufficient deterrent. It was unclear who the enforcement authority or agency. Some of the implementation details were also vague. And then a key issue that has come up is it's hard to determine whether a product is flavored or not. At the point of sale or during an inspection. And so while some, like bubblegum or grape are a little easier based on the packaging, we've seen concept flavors emerge. And a lot of these that you see have links. I think the slides will be provided so you can see these with more detail, but this is a resource from UC Davis that gives some examples of concept flavors, fusion, solar, jazz, which are difficult to assess whether they're flavors or not. And so with these challenges and gaps, the state legislators have responded in advocacy groups we've had more activity in recent years to try to bridge these gaps and to support implementation and enforcement. And so in the next couple of slides, I'll just provide a quick overview of laws that have been enacted in the last couple of years. So this is one, Assembly Bill 935 was signed into law in 2023. It's been effective since January 1st, 2024. And these are some of the key components that I pulled out to mention today. So trying to align SB 793 with another tobacco policy enforcement processes, the Stop Tobacco Access to Kids enforcement, so aligned enforcement processes with the STATE Act. It also expanded the definition of retail locations. Now you have vehicles, mobile units, booth stands, and concessions that are also the target of SB 793, so expanding these pieces. You have the California Department of Public Health established as an enforcement agency. Now we know it's Office of Youth Tobacco within CDPH. You have more details on inspection authority and process details, including having on-site compliance checks and trying to promote interagency coordination and being able to share inspection results with CDPH. And these increased civil fines and penalties. So not only increasing the amount of some of the fines, but also being able to suspend or revoke licenses. And then on the next slide, I have 2 bills, but I'll focus on another one. Both of these were signed into law just a year ago and are effective as of January 1st of this year. First, Senate Bill 1230, which focuses on strengthening tobacco oversight programs, but also allowing seizure and destruction of illegal flavored products, and also targeting beyond the retailer other entities on the supply chain. And then in the next piece, and I apologize, I'm going kind of quickly, but you'll have these slides. I just want to touch on some of these points so we can get to the other presentations. This one, a lot of us are really excited about, Assembly Bill 3218, that is establishing this unflavored tobacco list. So part of it's requiring and allowing some time for the California Attorney General's office to develop an unflavored tobacco list that's supposed to come out by the end of this year. And so other jurisdictions in the country have tackled confusion about what's banned and what's not by creating a list of products that are banned. And what we've seen is it's hard. It's hard to kind of keep up and keep adding to the list of banned products. A couple other places on the East Coast have had that challenge. Instead, California is taking this approach of an allowable list, right? And if you're not on the list, your product's not on the list, it's not allowed. And so we're really excited to see this. But that is a lot of work, and that's underway right now. And there's also these other pieces in AB 3218, which creating a fund and adding some expenditures, right, and funds to support these processes through initial renewal application fees. We've also seen the expansion of characterizing flavor to include cooling sensations, and nicotine now includes synthetic nicotine and analogs to try to cover these other additional gaps. The California Department of Tax and Fee Administration, other law enforcement agencies are now also permitted to seize illegal products and impose fines. And importantly, you'll see in the next presentation, there's been this confusion that online sales are exempt, but they're not. They're actually also covered, and now it's clear they're covered by either the state or the local policy in place. And so I'm grateful to the California Department of Public Health and encourage you to see their resources. This has a flavors fact sheet and it's a screenshot of the penalties. I won't go through it in detail. I'll just flag, you see not only retailers now, but wholesalers and distributors can also be penalized, right? So multiple entities along the supply chain can receive these penalties if they're in violation. You see cumulative kind of consequences. So one violation versus 2 or 3, you can get your license suspended and license revoked. And so you see kind of these different components in place now. And then at the bottom, you see a table where the STATE Act, which focuses on reducing access for minors and illegal flavored tobacco sales. So often it's minor decoys that are sent in, or you see compliance to try to understand both of these pieces. So you see greater violations if both of these these laws are being broken at the same time in a retail setting. And then I will end with these resources, encouraging people to visit the California Department of Public Health. They have really great resources and information for retailers and for the general public, including some in Spanish, some of these updates of the new law, since it's been such a dynamic environment that you can read about. And then I will direct you to see who you can contact. If you are interested in contacting, if you have enforcement questions or you want to report violations or share this information in your community, here's some information with the Office of Youth Tobacco Enforcement or CDTFA. And so with that, I will stop. It was kind of a quick overview, really excited about the next presentation. The reason we have kind of kept up with this policy environment in detail is actually because of a project that now Dr. Herrera will be presenting some preliminary results from. So I'm really delighted to introduce Dr. Ana Herrera. As she said, she's a tobacco policy postdoc here at UC Irvine, but she's a mixed methods health disparities researcher with over 14 years of experience working with government, philanthropic, and nonprofit organizations. She earned her PhD in health behavior and health education from the University of Texas at Austin, where she examined the tobacco retail environment, including targeted marketing and access in low-income communities of color and around college campuses. She also has an MPH from the University of Texas School of Public Health, and she received her BA locally from psychology and Latino Studies from Cal State Long Beach. And I've just had the privilege of the last 2 years of working with her on this TRDRP-funded study where we're assessing implementation of California's flavored tobacco sales ban, which is why we've kept up with the policy environment. And I originally started this study at UC Merced. Have been really happy to partner with the Nicotine and Cannabis Policy Center. Thank you to the NCPC for this opportunity. But yeah, Anna's just been foundational to this work and project. So really excited for her to share some results from the Central Valley in this next presentation, where she'll be talking about from policy to practice, lessons in local implementation and enforcement. Thank you.
Thank you so much for that lovely introduction, Dr. Bayan. And I'm really thrilled to be here with you all today to walk you through what we've learned about local implementation and enforcement of the flavor bans. So to provide some study background, so we conducted a mixed methods case study to better understand how the flavored tobacco sales restrictions, or I'll be referring to them as flavor bans, how these are being implemented and enforced. So specifically, we looked at the systems, processes, and infrastructure that support compliance. So our study really focused on two locations, the city of Santa Ana, which is located in Southern California, which has a comprehensive flavor ban, and Kings County, located near the Fresno area, which we will learn more about from our presenter from Fresno Public Health. But for today's presentation, I'll really be focusing on the findings from Kings County, which has an SB 793 level coverage with exemptions for those three products that were previously mentioned: hookah, large cigars, and loose leaf tobacco. And so just to give you a little bit more context of Kings County, so Kings County is predominantly rural and agricultural region. The adult tobacco use is about 8%, 71% of the people have health insurance, and about 1 in 3 families live below the poverty line. Next slide, please. So we gathered data from 3 sources to better understand how the flavor ban is being implemented and enforced. So first, we conducted in-person surveys with tobacco retail employees to assess their awareness and understanding of the policy, their level of support, and any challenges they face with implementation and enforcement. So we had a total of 29 employees participate, which equated to a response rate of about 33%. We also conducted observational assessments at these tobacco retailers to document product availability, essentially using that as a proxy for compliance. And out of the 100 retailers in our list that we identified, 88 met our eligibility criteria and were included in our study. And then finally, we really wanted to get a broader view of how implementation and enforcement is playing out throughout California. So we conducted virtual interviews with 19 key informants. So those were individuals that were involved in either the implementation, enforcement, or both, since some people had dual roles. And of the 29 stores that participated, the majority, so about 69%, were convenience stores with gas stations, followed by 21% of tobacco and vape shops. So in terms of who we spoke with, most retail employees were clerks or cashiers and had either a high school diploma or some college education. When it came to nicotine use, responses were a little bit more mixed. We had 38% reported never having used products like cigarettes or e-cigarettes, while others said that they had used them before, but not within the past 30 days. And then we had 24% who had used a nicotine product within the past 30 days. And now on to the findings. So we were really encouraged to see that the vast majority of retailer employees were aware of the state's flavor ban. So that's likely due in part to outreach efforts from the California Department of Public Health, which has distributed policy materials both online and mailed to licensed retailers. But when we dug a little bit more into their knowledge of the actual policy details, things got a little bit more fuzzy. So only half of them correctly identified hookah as exempt under SB 793, and also about half were aware of the increased penalties for the violations. Interestingly, though, 72% believe that online sales of flavored products were still allowed, which is not the case, as we just heard. But to be fair, those last 2 points reflect more recent policy developments. So it is totally possible that updated information just hasn't reached the retailers yet. And speaking of outreach, so while educational materials have been available, it's unclear whether the retailers are actually receiving them, understanding them, and sharing them with their staff. So that gap in communication may be something that's contributing to some of the confusion that we observed. And when looking at retailer engagement gaps and information needs, we found that about 2/3 of the retailers, so about 66%, said that they had received some information about the policy. But when we asked them if they'd be interested in receiving additional materials, only 21% of them said yes. So that said, several did express interest in specific practical resources, like a list of restricted flavored products or a simple policy summary that they could use to educate customers about the policy whenever they came in and asked about the flavored products, and they were told that they were no longer available. Next, please. And when we asked the retailers about their support for the policy, about half said that they opposed the flavor ban. So those reasons included the losing sales, distributors not taking back the banned products. Some people also felt that the policy was unfair because tribal lands and military bases were exempt, which is something particularly relevant in Kings County where they have both, and that customers can still access flavored products online or through social or peer networks. For the observational assessment, we were pleased to see that most of the flavored tobacco products were unavailable or had limited availability. However, about half of the retailers did offer those concept flavored products. So AKA those products that have ambiguous names that don't clearly identify a flavor. So like Wild Rush, Marigold, and most still offered explicitly labeled non-menthol cigarette products. And in addition to the surveys and observational assessment, we also wanted to get a broader understanding of how flavor bans are being implemented and enforced throughout California. So we wanted to get the perspective from the implementation and enforcement agents to see what challenges they're observing from their work. And so one of the biggest challenges that they highlighted is that flavored product sales continue despite the policy. So retailers are getting increasingly creative in how they get around the ban. So we heard examples of things like hidden fees, fake walls, furniture, even coded language or symbolic items used to signal flavored products to customers. So I'd really like to share a quote from one of the interviews that really captures the complexity of what enforcement agents are seeing when they go out. So there's this whole system of if you show a baseball card, they know you want flavors, or if you're wearing a certain kind of hat backwards, they know you want them. The people who are choosing to disregard the law, we know who they are, and they are getting plenty of attention, but at the same time, it means a lot of time and resources from enforcement staff. Next, please. And unfortunately, the challenges don't stop there. First, there's still a lot of confusion around what actually qualifies as a flavored product. The guidelines aren't always clear, which makes consistent enforcement difficult. Second, the enforcement agencies often face limited resources and staffing capacity, which really constrains their ability to monitor and follow up on violations. There's also a lack of interagency coordination. So in many cases, the agencies responsible for the implementation and those who are tasked with enforcement are not the same folks. And there's limited coordination and sharing of data. And even though product seizures are now allowed, there are some logistical and environmental concerns that are coming up about proper storage and disposal, as these enforcement agents have confiscated thousands of these products to date. Next, please. And as many of you know, the tobacco industry is really quick to adapt its products to evade flavor bans. So because there's currently no standardized guideline for identifying these flavored products, enforcement agents have really had to rely on tools like sniff tests, ingredient lists, or informal sources like Reddit forums. But the industry continues to evolve. So packaging is now being designed with multiple layers to block scent detection. Ingredient lists are being removed from websites, and those informal sources are not always reliable. In addition, some tobacco distributors are misinforming retailers about what products are allowed. And as retailers rely on distributors to supply those approved products, this misinformation can lead to unintentional violations. But the good news is that help is on the way. As they had mentioned previously, the Attorney General's office is expected to release an unflavored tobacco list later this year, which should assist with flavor determinations and help reduce some of that confusion. So this list will provide enforcement agents with a consistent reference point, making it easier to identify which products are compliant and which are not. It's a much needed step towards standardizing enforcement and supporting the frontline efforts. And our next presenter from Change Lab Solutions will speak more in depth about equitable enforcement. But before we transition, I wanted to share some of the key findings from our work that really highlight the barriers that can make retailer engagement and equitable enforcement difficult in practice. So for one, there's the sheer high number of retailers that make consistent outreach and oversight difficult. I heard from some folks that they have several hundred retailers, and so it really makes it difficult to make it out to all of them in a timely way. There's also limited sharing of retailer and compliance data across jurisdictions and agencies, so that also makes it difficult to track non-compliant retailers, and it's difficult to make it out. It's difficult to keep track of what violations they have. And there's this wide variation in agent training, the protocols, data monitoring, and evaluation. Then we also have external events like COVID-19 and the regional wildfires, which have disrupted the outreach and really slowed down the momentum, which can be difficult to get back on track. Then there's also resource constraints like limited funding, training, and staffing, which make it challenging to sustain consistent engagement with retailers. And then the educational materials, which may be available but may not always meet the retailer's linguistic or cultural needs. And creating those also requires resources. Next, please. And so all of these factors contributed to a common concern that I heard from multiple participants that I interviewed, that uneven enforcement may actually deepen existing tobacco-related disparities. So currently enforcement is carried out by various agencies depending on the jurisdiction. In some places it's a health department, sometimes it's law enforcement, code enforcement, CDTFA, or maybe a combination of multiple agencies. But these agencies vary in their authority, their capacity, and prioritization of the flavor bans, and the community trust and relationships that they have with the retailers and the broader community. So for example, we might have a public health department, which may have those trusting relationships with communities. They have high capacity and are more likely to prioritize enforcing a flavor ban, given their mission to support public health, but may not have the authority to cite retailers for a violation or be able to intervene in an unsafe situation. On the flip side, we might have law enforcement who has high authority and is able to intervene in those unsafe situations, but may not prioritize enforcing a flavor ban as safety is their priority, and they may not have the best relationships with retailers and the broader community. So moreover, those disparities in inspection patterns and the penalties may reinforce the systemic inequities, so especially in those communities that have been historically targeted by the tobacco industry. Because it's not just about increasing enforcement in these areas, it's really about ensuring that enforcement is carried out in ways that actively promote equity. And so I wanted to share this quote from one of our participants who spoke on the importance of transparency and compliance data. And they said, I think it would be really interesting to look at that compliance data. And you can even ask if agents go into one jurisdiction and they find there's violations, how are they treating those who violate? Are they treating the violations equitable across the board? Are the business owners African American or Hispanic or from a Black and Brown community? Are they getting higher fees than retailers who are white? I don't know. Those are all really good questions. And I really love this quote because I think this quote underscores the need for transparent, disaggregated data, not just to track the compliance, but to ensure that enforcement practices are fair and accountable. Next, please. And so to wrap up, I really wanted to share a few recommendations informed by what we heard throughout our study. So first, we really need to be equipping retailers and frontline teams with lay policy resources and training, like the upcoming unflavored tobacco list. So this will really need to be shared with retailers, distributors, and enforcement teams. So ideally, that means offering these materials in multiple formats like printed guides, online portals, emails, newsletters, and in multiple languages to ensure accessibility. Second, we need to strengthen cross-agency collaboration through shared trainings and protocols on things like product identification and scenario-based approaches for engaging with retailers. So sharing that compliance data can also help reduce that confusion and duplication of efforts. Third, we need to increase transparency of enforcement processes because when retailers understand how those inspections work and why they're being selected, it really helps to shift the dynamic from fear to partnership. And transparency is key to building trust and making that flavor ban enforcement feel fair and consistent. And then finally, inspections should really be integrated into existing tobacco control infrastructures. So when I spoke to folks, many said that they already have some kind of tobacco control infrastructure in place for things like TRLs, checking for active retailer license, or underage sales. So embedding inspections for flavored products into routine activities will not only help streamline the enforcement, but it will also make compliance feel like business as usual and not an added burden. And so before I close out, I just want to give a quick shout out to our amazing team at UC Irvine and UC Merced, whose efforts make all of this possible. And I also want to thank Elizabeth Anderson Rogers from the California Department of Public Health, who has been incredibly supportive and provided valuable guidance throughout all of this work. Thank you.
And Dr. Herrera, as you've already shared, our next speaker is now Jessica Breslin, who is a senior attorney at Change Lab Solutions. Jessica brings a wealth of experience in advancing health equity through law and policy. Before joining Change Lab, she provided civil legal services coordination and direct representation at the Alameda County Collaborative Court. We're incredibly fortunate to have you here and to learn from your expertise. So I turn it over to you.
Thanks so much. I'm so happy to be here today and talk about a little bit more in depth about equitable enforcement and different policy considerations you might want to make when you're thinking about local tobacco control. I feel like I've been sufficiently introduced, but again, I'm Jessica Breslin. I've been working on tobacco control since 2018, and I also do a lot of work around equitable enforcement. Today, we're going to do a little bit of level setting to talk about equitable policy making. Then I will talk about equitable enforcement, what that means, the different types of enforcement, and then how you could embed ongoing evaluation into enforcement policy. And then lastly, I will go over some of the resources that are available for free on our website. So here at Change Lab, we believe that everyone should have a fair shot at living their healthiest life, regardless of where they're from, what they look like, how much money they make, or where they get their news. Laws and policies can be powerful tools for helping make sure community-wide resources like healthy housing, nutritious foods, safe streets and parks, clean air, and jobs are distributed more fairly. Because when folks facing the biggest challenges leading to healthy lives are given a more level playing field, we all benefit from the gains. So just to start out, I have to give this disclaimer every time. While I am a lawyer, I'm not your lawyer. So we don't provide legal advice or enter into attorney-client relationships at Change Lab. And I also wanted to note that during today's session, nothing I say is intended to reflect a specific view on any specific legislation. And then also when I'm talking about tobacco today, I'm always going to be talking about commercial tobacco, not tobacco products used as part of an indigenous practice or other religious spiritual practice. So just to start out, we all know that tobacco prevention is one of the oldest and considered one of the most successful public health efforts because of work like yours. And we also hear time and time again that there's still so much left to do. There's many challenging, socially complex, ever-changing, and industry-driven difficult work that remains. So just thinking about the previous presenters when they're talking about the unflavored tobacco list, that is intended to like kind of get rid of this whack-a-mole situation where you have one flavor and then if you get rid of that, then they come out with a different terminology and different language. And then I also wanted to recognize that I'm going to be using words like equity throughout the presentation, but there's different framing that works in different communities, and that might not be the language that works best for you. So just a quick overview of Change Lab's framework for policy interventions. If you want to take a look on our website, there's a lot more detail, but we've identified 5 main drivers of inequity. So those are structural discrimination and structural racism, income inequality and poverty, disparities in opportunity, disparities in political power, and then governance that limits meaningful participation. And that could be like things like how available or accessible is it to actually participate in meetings and things like that. And then also for a grounding definition of health equity, this one is from Dr. Paula Braverman, an expert on health equity and social justice. So she defines it as health equity means everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and all of their consequences. So this definition highlights that working to promote health equity means working on the root causes that lead to inequities in our community. We've paired this definition with the common bicycle images from Robert Wood Johnson Foundation, showing this difference between equality, where everyone has the same bike, but that bike isn't necessarily serving their diverse needs, versus equity, where each person has a bicycle tailored for their use. And then for many people, thinking about why what health equities are and why they exist. For many people, good health is nearly impossible to achieve. Across the country, the burden of poor health, from preventable chronic conditions to diseases of despair, falls disproportionately on families with low incomes, on individuals with a low level of education, on children, and on populations of color. We probably all hear a lot about social determinants of health, and at Change Lab, we strive to address the fact that they include historical and continuing injustices. The institutional and structural components of the social determinants of health should be understood as sites for organized and deliberate intervention. And law and policy have been central to creating today's health disparities. They've made resources scarce for many and created unhealthy environments. But those very same law and policy tools can be used to create positive change. While I realize that many of us are likely already familiar with these concepts of health equity and the social determinants of health, I think it's important to frame high-level legal policy conversations in this context and to remember why we do what we do and to align priorities as we discuss the many options and infinite contexts for doing our work. So thinking about how do these concepts fit within the tobacco prevention movement, a movement that has experienced many incredible and undeniable successes long before health equity or social determinants entered the public health lexicon. And many of those best opportunities to advance equity exist at the local level. Local governments are often closer and more responsive to the populations affected by policy decisions and can be more responsive to specific community concerns. They can also drive innovative policies that would be difficult or impossible to pass at higher levels of government. And the key takeaway that I want to stress is that operationalizing health equity is about more than outcomes and reducing disparities, both of which are important, of course. But it's also about process, listening, and empowering communities and amplifying their voices, about building resiliency. So that can be things like community-directed policy. So designing when we were talking about earlier about rural communities, what makes sense in Oakland, where I live, does not necessarily make sense in Atwater, where my mom lived for many years, because the outcome looks different. And so you can have different policies that are community directed. You can also empower communities to focus on their strengths and support resilience. You can also invite varying perspectives. So talking both to tobacco users and also talking to retailers and designing the policy that makes most sense. You can also consider, sorry, can you go back? You can also consider trade-offs and how you use data and employ strategies to equitably direct resources. And then, of course, looking at evaluation and accountability, which can be built into your policies. But identifying the need to apply health equity principles to tobacco control is one thing. Operationalizing those principles is more challenging. It is not an issue that we can solve overnight. So some of those challenges were highlighted earlier. This slide outlines 3 questions that I often revisit whenever I'm thinking about the potential equity implications of a particular policy. Of course, there might be more complicated questions you want to ask, but this can always be a helpful starting point. So first, you want to think about who's the individual or community that has been harmed by past policies or current situation. Second, you want to think about who stands to benefit from a particular policy and how exactly would they benefit. And then lastly, you want to think about how can we prevent future harm. And in order to ultimately eliminate tobacco-related health inequities and tobacco-related harm more broadly, we need to start thinking further upstream about the root causes and social determinants for tobacco use and poor health. From discrimination and poverty that creates the stress that leads people to use tobacco as a coping mechanism, to predatory industry practices that distort consumer choice, to access to education, stable housing, and green space. We need to move from blaming poor health on individual choices that people make every day to an understanding of the overlapping systems that influence people's everyday lives. We need to work on the level of changing systems and structures that unfairly contribute to tobacco use and poor health. And one way of doing that and looking at changing systems and structures is to think about how tobacco control laws are enforced. So what is equitable enforcement? Our definition is that it's the process of ensuring compliance with law and policy that considers and minimizes harm to underserved communities. So when we think about equitable enforcement, we're usually thinking about two different concepts that overlap. One is under enforcement, and that's when the laws and designed to protect communities are not consistently enforced. So it might be a little hard to see with the colors, sorry about that, but that one picture is talking about opioid litigation. So that might be something that's under enforced, even though it is designed to protect communities targeted by pharmaceutical companies and most affected by the opioid crisis. And then there is also over enforcement, which is when laws designed to protect the health of the public are enforced more frequently or more strictly in certain places or against certain people as compared to others. So thinking back to previously when we were talking about that enforcement agent's quote about how they weren't sure if certain businesses are being targeted more frequently that might be owned by people of color, things like that. The picture here is about a homeless the sweeping of a homeless encampment. So sanitation laws are designed to promote health, but that might have disparate effects on underserved communities like the homeless population. And then what are the different aspects of enforcement we're thinking about? So who can enforce? That was already touched on a little bit about whether it's police or and what that might mean for different communities. If police are enforcing these laws, that might have a history of mistreatment by those enforcement agencies, or is it the public health department and things like that? And then second, we want to think about, are we targeting entities or individuals? So that's part of the moving upstream. So thinking about looking at this picture right here. On the right, there is a police officer arresting a man for selling loose cigarettes, while inside there's a retailer who's selling to a child, and thinking about, are we targeting the people with the most power, or are we targeting individuals? And then next, you want to think about the role of victims and communities. So who's being harmed and what is their role in the policy process, and how can they help make your policy more targeted to help them while reducing harm? And then we also want to think about investigative and adjudicatory processes. So what does that look like? Who's investigating? Adjudicatory processes could be like, is there an appeal process? Things like that. And then lastly, we want to think about a range of sanctions. So that's kind of when we were thinking about that law earlier about TRL, how there is warnings, and then there's also fines, and then it can escalate to things like license suspension. And then thinking about how we design policy when we're enforcement policies with equity in mind, we want to make sure, again, we have that graduated enforcement, a range of sanctions. So thinking back, I worked in Alameda County with them on developing a smoke-free multi-unit housing ordinance. And one important aspect of that, especially when you're thinking about that it targets individuals, is they wanted to start off with an education process. Did you know that this was a policy? You're in violation of it before you jump to fees and fines. And then also thinking about what kind of non-punitive enforcement measures are you offering? So in the smoke-free multi-unit housing context, that might be offering cessation services, things like that. And then really thinking about who you're designating as enforcement bodies. Again, thinking if you have police enforcing certain policies, are they trusted in the community where that they're going to be enforcing, and can there be unintended negative consequences for that? And then lastly, we like to talk about guardrails for discretion. So a lot of times zero tolerance policies and things like that can have unintended negative consequences. So it's important. Sorry, there's a fly flying around my apartment. So it's important to have some discretion in enforcement policies, but you also want to make sure that you're providing enforcement officers guardrails for that discretion so that they're not making decisions totally on their own. And then some more considerations you might want to do when thinking about equitable enforcement is the role of the community in enforcement. So are they helping develop enforcement policy measures? Are they given forums to provide feedback on how the enforcement is going? thinking about data collection and ongoing evaluation that can be written into your policy, and thinking about adequate funding for enforcement. So especially when you're thinking about TRL, if you have a local tobacco retailer licensing ordinance, are you charging a fee that can help fund enforcement and also fund evaluation? So we have a tool on our website that is a sort of Excel spreadsheet calculator to help you figure out what would be an appropriate fee for your community. And obviously that might change depending on there's retailers within your community and what they're able to pay, but that's something that can be written in specifically to your policy to help fund those things. Another important consideration would be ongoing training for enforcement officers to make sure that they are aware of the change in the policies. So like, for example, with this unflavored tobacco list, training for enforcement officers on what that means, how that works, how they should be using that tool. And then lastly, policy updates based on ongoing evaluation. So if you've built in that funding as part of your TRL fee, and in order to do ongoing evaluation, part of that is being able to update your policy based on the information that you're seeing. And then here, I'm just going to go over some of the resources. These are all free on our website. So we have a tobacco point of sale preemption playbook. And so it provides somewhat of an overview of what preemption is. This fly is really excited about tobacco control. And it also, what preemption is and how it works. There's some case studies about point of sale preemption. There's key steps and legal considerations that you might want to go through and how to undo preemption. Luckily in California, the state mostly has a non-preemption clause, so it's pretty free on the local level what you can do. And then these are just some resources that we have, some infographics that discuss how to reduce tobacco retailer density and why you might want to do it. We have that available in both English and Spanish. And then these framing and messaging strategies. So sometimes it can be hard to talk about these issues, or it may be more difficult. So we partnered with the CDC, the California Tobacco Control Program, and the Frameworks Institute, and they have a lot of great framing resources about how to talk, what the most effective way is to talk about tobacco control and why it's important. They also have videos and have done a significant amount of research as well. And then we just have a number of model policies, playbooks, fact sheets, and infographics on our website that you may want to check out. There's model policies around TRL and smoke-free multi-unit housing, things like that, as well as playbooks, and just a ton of resources that are free of charge on our website. And then if you want to go in more depth about equitable enforcement, we have an equitable enforcement guide that also explains all these concepts in more depth, has some local examples and case study examples about how that might look in different communities. And then there's also an audit tool. So if you want to go through your existing enforcement policies, you can use that to look and see like where there might be issues and different things that you can change. And then just generally at Change Lab, we provide training and webinars. We make model policies, provide technical assistance. So for example, I've done a lot of work with the Alameda County Tobacco Control Program, and when they were tackling some of those flavor issues. So one of the things that we did for them was help come up with like an enforcement protocol for how to determine beyond sniff tests and things like that if a product was flavored. Hopefully that will be less necessary now with this unflavored tobacco list. But we also have we develop guides, fact sheets, and infographics. And I think we're waiting for questions to the end, but thank you everyone for allowing me to talk to you today.
Thank you, Jessica. Yeah, we will be saving, Irene, I see your hand up. Once we get into the Q&A, I'll circle back, and then there's some comments that just want to make sure there's no there is actually follow-up in the Q&A, but please post your questions on the Q&A, and we will go on those in order. So now we're very excited to introduce representatives from the Fresno County Department of Public Health. And we're looking forward to welcoming you, Layla and Jessica. Please take it over.
Good morning, everyone. Can everyone hear me okay? Okay, so today Jessica and I are excited to share the Fresno County Tobacco-Free Coalition's journey in local strategic policy planning for the smoke shop ordinance for the city of Fresno. This presentation will highlight the significant efforts and strategies we've employed to address critical community concerns and promote public health. So here with the Fresno County Tobacco Prevention Program, our mission is to reduce tobacco use and exposure to second and third hand smoke. Our program offers information, education, and training to support changes in individual behavior, as well as our environments. And our program is committed to serving the diverse health needs of the community and to improve the overall quality of life in our county. So I would like to take a moment to introduce you to our fantastic tobacco prevention program team. And while Jessica and I are the only staff members presenting today, I did want to acknowledge Hope Megardician for all of her hard work on the smoke shop ordinance. Hope is our wonderful coalition and community engagement coordinator. So in June of 2025, the city of Fresno adopted a very controversial zoning ordinance that includes provisions inspired by a local tobacco retail licensing program. The ordinance includes limiting the number of smoke/vape shops to 7 per city council district, which is a total of 49 citywide. Approximately 32 existing businesses will eventually be required to close. The businesses that will receive a conditional use permit will be selected through a lottery system. And though we're not altogether sure of the final cost of this conditional use permit, it appears to be at least $10,000. The ordinance prohibits smoke and vape shops from operating within 1,000 feet of schools, parks, daycare centers, and youth facilities, and other smoke and vape shops. And there is no exception to this provision. There also is a fine for selling tobacco products to minors at $2,500 per offense. And businesses that do not receive a conditional use permit will have an 18-month amortization period to transition either into a different business model or close their operations. This provision does allow for an extension of the amortization period. So the city of Fresno's motivation for passing the smoke shop ordinance was really multifaceted. The city was experiencing a significant increase in emergency calls related to these establishments, including 1,200 calls for service and 36 reported violent crimes. Community members voiced their concerns, with council members frequently receiving complaints about the operations in the smoke shops. And with funding from the Department of Justice, a cannabis grant, the city conducted inspections and undercover operations at the smoke shops. And during these investigations, they discovered the illegal sale of flavored tobacco, both openly and covertly. Additionally, they found several businesses operating without city-issued licenses. Illegal gambling activities were occurring. There were cases of human trafficking. The sale of illegal cannabis happened, along with this illegal sale of ammunition and firearms, and illegal distribution of flavored nitrous oxide, commonly known as whippets. So now that you know a little bit about the smoke shop ordinance, now we would like to talk with you about the policy development process and the Fresno County Tobacco-Free Coalition's role in that process. In early 2023, the coalition became aware of the policy and met with the city attorney's office. During this meeting, we provided local observation survey data and shared the Public Health Law Center's model tobacco retail license ordinance. We also met with the sponsoring council member. When we received an early draft of the policy, the coalition reached out to Public Health Law Center to analyze the policy language. And Public Health Law Center determined that the policy was similar to a cannabis ordinance and did not follow a lot of the TRL best practices, and it lacked a strong enforcement model. The coalition met with the council member on multiple occasions to provide feedback on the draft ordinance and alternative language about the TRL. And during these meetings, the primary sponsoring council member provided context that although this policy would partially address illegal tobacco product sales, it was not the primary focus for the policy. And the sponsoring council members appreciated the TRL education. However, they were not interested in the tobacco retail licensing policy at the time. So the coalition was really in a challenging spot. We asked ourselves, should we support this policy? While it is inequitable, it indirectly addresses illegal tobacco sales. So we did a lot of planning and a lot of thinking, and we consulted some key community leaders. Our team consulted with a key City of Fresno official who provided insights that were valuable guidance on how to proceed with our TRL goals and still maintain a relationship with the city. And Jessica will show more on that strategy soon. So I would like to provide some additional context for the webinar participants regarding the smoke shop ordinance. The Fresno County Tobacco Free Coalition and the Fresno County Department of Public Health would have approached the smoke shop ordinance differently if the city of Fresno had a tobacco retailer licensing ordinance in place. But unfortunately, this was not the case. And we were clear on the concerns that if the city council passed the smoke shop ordinance, it might lead them to believe that they had sufficiently addressed tobacco-related issues, ultimately hindering any progress toward establishing a comprehensive tobacco retailer licensing program. And the primary focus of the smoke shop ordinance was to eliminate illegal activities that were rampant in these stores, including gambling, human trafficking, unlawful sale of ammunition, firearms, and flavored nitrous oxide. Additionally, the illegal sale of cannabis was a major concern for the city, as Fresno City permits cannabis dispensaries. The unlawful sale of cannabis at smoke and vape shops was detrimental because it diverted tax revenue that could otherwise be generated by authorized cannabis dispensaries. So the primary reason the coalition did not endorse this ordinance is that it focused solely on regulating smoke and vape shops rather than considering all tobacco retailers. And the coalition consulted with state experts, including the Public Health Law Center, the American Heart Association, the American Lung Association, Tobacco Free Kids, the American Cancer Society Action Network, and all agreed that this ordinance lacked an equitable approach. In the city of Fresno, there are 564 tobacco retailers, yet this ordinance only regulates 14% of these shops. And as previously mentioned in the presentation, the ordinance only permits 7 smoke shops or vape shops per district. And while the coalition appreciated that this would reduce the number of tobacco retailers in the community, it raised concerns about the lottery system that would randomly select which shops could remain open. Those not chosen in the lottery system would either need to change their business model or shut down. And the coalition and the Planning Commission found the randomness of the lottery system to be very problematic. Additionally, the cost to obtain a conditional use permit starts at approximately $10,000, which is exceptionally high and unaffordable for many on the development of their policy.
Thank you, Layla. I will continue with the second half of the presentation. So now that you have context about the smoke shop ordinance and know why the coalition did not endorse the smoke shop ordinance, I'll be talking about the approach we took. As Layla previously mentioned, during our coalition planning and strategizing, we met with the key city official for further insight and guidance. And based on his feedback, the coalition took some time to figure out the best strategy moving forward. And that was the yes and approach. So you're probably wondering, what does that mean exactly? The coalition thanked the council for their efforts to address public, which was made known to the community when they were going on press conferences and speaking about this new ordinance. However, we also acknowledge that tobacco remains a prominent issue in the community that still needs to be addressed. Therefore, the coalition engaged in strategic planning, which resulted in these key activities that I have listed here on the slide. We really just maintain consistent messaging about the importance of addressing tobacco, including all other tobacco retailers, which is hundreds, as you could see in the previous slide that Layla presented. We also held TRL planning meetings with the coalition and a smaller policy work group that we facilitate. We did consensus building with the coalition on policy priorities, considering the various ordinance provisions, and I will talk a little bit more about that consensus building in a little bit. And we met with local representatives of voluntary health agencies to receive their expertise and guidance as well. And members of the coalition submitted letters to the editor. And on the slide, you will see some of the headlines of those letters written by our coalition members that were published by our local digital news outlets, such as Fresno Bee and others such as the GB Wire. So the coalition and voluntary health agencies sent letters to all council members as well, expressing their stance on the smoke shop ordinance. And finally, we had coalition members and volunteers from the community provide public comment in meetings where the smoke shop ordinance was discussed. And so as you can see also on the side, we have some of them pictured here, which did an amazing job. The coalition continued its education to council members on best practices related to tobacco retail licensing. And I know this policy has been alluded to earlier by our other amazing presenters, but just wanted to reiterate that a tobacco retail license, also known as a TRL, is a more comprehensive approach to protecting communities, especially youth, from tobacco access and use. It holds retailers accountable for allowing or for following federal, state, and local tobacco laws. The coalition did some consensus building to come up with policy priority areas. And during this process, which took multiple meetings, I will admit, we kept in mind the limited political will among some of the council members at the time to introduce a TRL. Therefore, we identified core policy provisions that would create a strong and sustainable retailer licensing system, even if the policy was not comprehensive. So the priority areas that we wanted council members to keep in mind were the following: monitoring retailer compliance with existing laws, so that includes all federal, state, and local tobacco laws; providing outreach and education to retailers so that they can stay informed with requirements of the laws; reducing inequities in how tobacco products are marketed and sold in different communities; establishing a fee that fully funds the administration and enforcement of the policy; and finally, defining an enforcement model that includes compliance checks for illegal tobacco sales to youth, regular inspections for the sale of illegal products or illegal tobacco products, and a penalty structure where violations of the policy are subject to tiered penalties, including fines, license suspensions, and revocation in a defined period of time. Here are some post-policy reflections and learning opportunities that we would like to share with you all. First one is, not only did we observe differing policy priorities between the coalition and their local elected officials, but also differing priorities between our state and local governments on the regulation of tobacco sales and the enforcement of existing policies. The coalition made an effort to maintain its relationships with the council members, and this meant being respectful of their ideas, transparent about our own, and being a reliable source when it came to providing local data that they requested, and just information that is evidence-based. We were intentional with our communication and who we approached for these conversations. An example being, we primarily met with and spoke to the sponsoring council members of the smoke shop ordinance, just to make sure that they were aware of the coalition stance and objectives when it came to policy. So when possible, we scheduled these meetings before the public city council meetings took place, so we could gain insight on those council members' perspectives but also provided resources or information that can help inform their perspective related to tobacco retailing. And for the third reflection here, a lot of time and effort was dedicated by the coalition towards the smoke shop ordinance, including understanding its goals and strategizing as a coalition and doing outreach to educate council members. And this, as a result, did delay our TRL campaign, but I will say not entirely, as there was some overlap. We found ways to incorporate our policy efforts where we could. For example, we continued to have planning meetings with our coalition to discuss next steps after a decision was made regarding the smoke shop ordinance, and we continued to offer TRL education to stakeholder groups to help raise awareness of the best practices available. And lastly, we were torn between celebrating the passage of the smoke shop ordinance as a win from a public safety standpoint and something that the community highly supported, and feeling like this was a loss from a tobacco prevention, and I should say a public health lens, and knowing that this ordinance was not completely based on best practices. However, we came to realize that these are not mutually exclusive. Both sentiments were valid and coexisted. I do want to talk about what worked because the smoke shop ordinance allowed the door for a tobacco retail license to open. And I'll share about this in more detail in the next couple of slides. But I do want to add as a caveat that these are tactics that worked for us in our local and political context. So strategies could look different for other jurisdictions who may be looking at a similar policy, just depending on available resources, partnerships, relationships with your local elected officials, and of course, already existing policies. So one of the strategies that worked, which was previously mentioned, was the coalition delivering consistent messaging to all council members. That could be through public comment, letters to the editor, op-eds or opinion editorials, letters to council members, and public comment from speakers in the community. Another important activity was including community voices and having personal stories. So the coalition and other community members shared their personal stories during one-on-one meetings with council members, as well as during public comment at the City of Fresno Planning Commission and City Council meetings. And the coalition was very intentional about relationships with community agencies. So we fostered those with stakeholder groups such as the American Cancer Society, Cancer Action Network, American Lung Association, and Tobacco Free Kids to help build knowledge of tobacco retail licensing. They empowered coalition members to share their stories and knowledge, and they exerted a great level of influence on policy outcomes through their great expertise and advocacy. As I previously mentioned, we still want to acknowledge the small wins that came out of this. The final draft of the smoke shop ordinance included the coalition and voluntary agencies' recommendations to expand definitions. So for example, they expanded on the definition for tobacco product to reflect that of California's law, and they separated or separately defined smoke/vape shops from other tobacco retailers to make it more clear there. They established location restrictions. So smoke shops cannot be located within 1,000 feet of sensitive uses, such as youth facilities, public or private state licensed or accredited schools, or alcohol or other drug use recovery or treatment facilities, and other smoke shops with no exemptions. And they also banned flavored tobacco products, which have been widely available for sale at local tobacco retail locations, even after the statewide flavors ban has passed. And so during the meeting where it was adopted, the smoke shop ordinance, 3 separate council members shared that they support tobacco retail licensing as an alternative or a complement to this ordinance. So that brings me to what is happening now. We still want to acknowledge the small wins that came out of this, of course. And the final draft of the smoke shop ordinance included, those recommendations that I had previously mentioned, but it is currently in progress despite opposition and legal action that we have seen taken from groups such as the State Smoke Shop Association. And, there's been some delay there in implementation, but it's still proceeding. And as I've mentioned, a sponsoring council member of the smoke shop ordinance is proposing a TRL ordinance soon, while 2 other council members are reportedly researching a TRL and considering the ordinance as well for the city of Fresno. So after receiving approval from all council members last month, the Fresno city manager is now conducting a TRL fee analysis. I do also just want to add that the coalition will continue their efforts to educating on a TRL and other evidence-based or best practices for tobacco prevention. I want to thank everyone, and to end the presentation, we leave you with some additional images of our coalition and community members who spoke at our city council member meetings for the smoke shop ordinance reading and in support of a tobacco retail license policy. And finally, here is how you can connect with us through email. We welcome any questions you might have regarding this presentation. So feel free to reach out to both Layla and I. And thank you again. We appreciate your time and really extend our gratitude to NCPC for allowing us to share our policy efforts in the city of Fresno with you all.
Jessica and Layla, thank you so much. You took me back to 2 summers ago. This was I was the co-chair of the Out with Big Tobacco Coalition, and I that's when I was, wow, I have a lot to learn. And that's actually what inspired me to, and then when we were looking at how we can partner with Dr. Denise Payan, with the new renewal of the NCPC, this experience really inspired me to start thinking about health policies a lot more broadly, and even by looking at all the terrific comments and questions, we're starting to see that, yeah, it's not just as simple as here's a policy, a new policy, to bring health equity about, that there's all these like intricate and localized issues. And I'm not going to get into my remarks. I was just giving time for everybody to turn on their video. I'm going to go in order. I know some of you had your hands up. I kind of kept track of a couple, and then I'm going to save the ones that are open right now kind of together, because those were a lot of very specific questions that are for both Layla and Jessica. So let me go to the top. So first, we had somebody asking, what is the purpose of exempting menthol from the flavoring restrictions? I believe that came up when you were presenting, Dr. Payan. And already Dr. Diaz-Garayua at Stan State and myself had made some comments about how, there was this whole other dedicated effort around menthol, and I shared the brief that we as NCPC, provided. But please do add any other comments or thoughts you have on the topic.
Sure. I just want to acknowledge, thank you, NCPC, and to all the presenters. This was wonderful. With regard to that question, I mean, at the time, it was market share for menthol was part of the reasoning for the exemption, likely in 2009. And we were really excited the last couple of years with the proposed rule under the Biden administration that, was ultimately, they didn't pick up on it. That was really disappointing last year, close to the election, and then was completely dropped this year. So that, managing federal policy environments is hard. And I think that speaks more to this year, the value of states and local jurisdictions, making sure to closing that gap. But we were really excited. I hope a future administration takes that up again, because that exemption has proven to be so problematic and really driving some of these disparities.
Thank you. Thank you so much. And thank you so much, Dr. Diaz-Garayua, for adding your comment. The next question, and please, I'm going to go slowly with the questions because one of our panelists did get kicked out and lost the Q&A, and unfortunately, it's not letting me cut and paste. I was hoping I could just cut and paste, so bear with me that I'm going to be reading them verbatim for the benefit of our panelists. So Katie Moose, another great point. If we conduct young adult tobacco purchase surveys at the local level, should we report violators to the state? What are the pros and cons of doing that? We are trying to build relationships and may not wish to burn bridges. And I had already added a comment that this important point touches on the potential tension of local efforts, that are faced, which is balancing that accountability and the trust building. And I think anybody on the panel could answer to this. So please, anybody could be first on this one.
I can just talk about our study since this is something we grappled with, and because it was a research study, we had an ethics board, the Institution Review Board, raised this question. We specifically did not ask about violations. We asked in the survey, we asked about inspection experiences and we asked about challenges, but we had a separate observational assessment for this purpose. So we wouldn't have employees self-reporting violations, right? Or the availability of these products. And so and the observational assessment, we specifically are using it to report aggregate data. We did this study in another jurisdiction as well. And the point is to understand proxies for compliance, for instance, the availability of these products. And this is not something that our team will be reporting individual shops, because that would undermine the ethical, what we've communicated to retailers and to participants, and it would also, we're also not enforcement agents. And so those are kind of the pieces that we thought through. This might be helpful, but it's an important question, really important question to grapple with when you're collecting data of any type, especially because I think we do want to promote interagency coordination and support at compliance data collection, but hopefully that gives some insight in how as researchers we approached it.
Anybody else would like to add? And thank you so much, Dr. Bayan, for that very thorough and thoughtful response to that.
I guess I could add that's like another reason to build in education around what the consequences will be, so that you're educating retailers, and also to have the graduated enforcement, right? So that maybe there's just a warning at first, and that could be part of that trust building and making sure that they're aware of what the policy is. But if that keeps happening and they keep doing it, then you can escalate the consequences.
Thank you so much. I'm going to move to the next one from Marilyn Holman. Thank you so much, Dr. Bayan, for reporting that the paper From Policy to Practice, Lessons in Local Implementation and Enforcement is not yet available. And thank you for sharing those results in advance. I love that you do that as a scholar, that you share, you disseminate, and then anyways, thank you for that, for modeling that. We have the next one. The question is there currently an effort to discuss or cross-discuss these topics with cannabis control folks out in the field, so that both entities working on these issues don't cancel each other out when speaking with decision makers? Yeah, I'd love to hear your comments on that from the panelists.
I love that it's the Nicotine and Cannabis Policy Center for this reason. For many reasons we will not get into, we're behind in cannabis policy research, and because of federal restrictions as well on research funding, on knowledge. And so I remember at NCPC, one of our community events, these parallel conversations and bills going to the floor in Sacramento. They're so different in how they talk about substances and products. And someone mentioned AB 1775, and that is in effect. And I think it speaks to, I'll just speak to the research side. It's really incumbent on us to make sure, and Dr. Ed and I are trying to get this integrated into cannabis policy research. So talking to cannabis researchers who are interested in policy ordinances, we need to think about implementation as well, because I do think that there's lessons learned for health policy more generally, including, for instance, nutrition policy. So I encourage our scholars and folks who are here or practitioners to engage in these discussions, because we actually do need more of this joint information development and the development of policies as well.
And I will also add, and I think it touches on another question that another person had, that I think from a public health standpoint, it's really important that we have these conversations with cannabis control people as well, because I did hear that allowing cannabis so much freedom could really inadvertently weaken the longstanding smoke-free norms that we have, established for tobacco, for like cigarettes. So by allowing cannabis to be smoked indoors, it could start creating more confusion about what products are allowed and where. And I did hear from some of the participants, including the retailers themselves, who were saying things like, well, if I can't sell tobacco anymore, then I'll just switch to cannabis because that's less regulated. And so that's something that was echoed as well from the implementation and enforcement agents who also share that sentiment of being afraid that we might see more of these cannabis shops popping up, taking place of like smoke and vape shops, for example.
And Dr. Herrera, what you just spoke to when we had our inaugural NCPC Tobacco Summit in Spanish 2 summers ago with Cultiva Central Valley, led by Claudia Corchado, the mothers were actually pointing exactly that out. They're like, what are you doing as tobacco control champions? And, you know, when there's so much flexibility around, you know, cannabis use. So our parents in the local region are seeing those contradictions, or, you know, those opportunities for dialogue and making sure that we learn from each other and that it's a little bit more aligned. Guilherme, and following up already, Dr. Payan mentioned that you posted on, that was you who posted about AB 1775. Thank you for that. And looking at you now, because you are, and also following Dr. Payan's suggestion, you are a PhD student in public health right now. And I'm looking at you. I'll follow up with you to see, you know, how you can weave this really terrific point and bigger question, you know, in your work as you're growing in your doctoral training. Okay, and then we had a couple of hands that went up before we move it into Fresno City. Oh no, you know what? We're going to move into the Fresno City. So there was a few questions that came out for Fresno City / county. Would you like to go ahead and answer those, Jessica and Layla? Are you still able to see those, the ones that I left open in the Q&A?
Yes, we can see them. Okay. Oh, can you all hear me okay? I think our internet is a little unstable. Okay. First question is, would it make sense to amend TRL language to include a list of prohibited products? I think I might punt that one actually to Jessica and see what her thoughts are.
Well, one thing, I think there could be two approaches. I think one thing we've noticed from reviewing policy language, whether it be for the smoke shop ordinance or just the TRL, sometimes vagueness allows for loopholes. And so I think that including a list could be beneficial in the sense that you're being very precise and clear in what is prohibited. However, you also run into the issue of, you know, updated products. And down the line, that could potentially mean having to update an ordinance to either keep including new products or eliminating. So I think it can go either way. Sorry, it's not like a definitive answer, but I think that's just kind of my thoughts on the pros and cons of doing either or.
Thank you. The next one also pointed to our Fresno partners. Did the smoke shops having any criminal issues, have any kind of business license? How do you think this all got so out of hand?
So that was a big thing. It wasn't all of the smoke shops that didn't have a business license, but when they started doing inspections and stings as a part of their cannabis grant, they did find that a lot of the stores did not have either the state tobacco license or a city of Fresno business license. And they just found that to be unacceptable. A lot of them were just being regulated like any other grocery store. And when they saw all of the violations that were happening at these stores, it really, you know, brought the issue to the forefront for the city.
Thank you so much. we have come to the really terrific questions. This is very helpful. I do see the ones that are still open, the ones where I could see an individual. I'll connect you, or well, we, the team. I also want to acknowledge Linnell Pantoja, who is an alum of the NCPC internship a couple of years ago. She's now an NCPC staff member. So if you see her name and receiving the executive summary, that is, you know, we put her in the deep end. She just started this month, and here she's doing an executive summary for us. So Linnell, thank you so much. But I will work directly with you. So anyways, thank you so much for being here. Please help me thank the panelists. Could you go ahead and move to the last slide, Alex? So you can have your name and email out if people need to follow up. We will be, this as it's already been mentioned, this is recorded. This will be available at the NCPC website. And just thank you so much for being here. This has been very exciting, I'm jazzed, I'm inspired, I'm invigorated. So thank you very much. And then there you go. So please reach out to us. And a big virtual hand of applause for the, no, there is no, I was hoping there was like some little emoji here, but there isn't. So silent applause. Thank you, everybody. Thank you. Okay. Thank you for joining us. And we look forward to staying in touch with everybody.
Thank you.